Hello, friends. I am Dr. Harvinder Singh. Welcome to our Academy's next clinically relevant discussion. And this is actually from our Child and Adolescent Psychiatry section. So, Journal of American Academy of Child and Adolescent Psychiatry just published this systematic review and network meta-analysis on this highly clinically relevant topic, where they did this network meta-analysis. They looked at all the studies, head-to-head placebo-controlled trials, and they looked at antipsychotic and mood stabilizers, and they looked at their efficacy and safety. So let's start the session today. This is the article that I'm talking about, Journal of American Academy of Child and Adolescent Psychiatry here. Now I will discuss these results in three sections. The first section is the primary outcome. So they had primary outcome and secondary outcome measures, right? Don't worry about the names, just look at the clinical facts here. For primary outcome, they looked at three things, but let me talk about the two first. First is manic symptomatology, and second is mania response. So manic symptomatology is how much the medication or treatment is reducing the mania symptoms. It doesn't mean it's responding, but it's reducing the mania symptoms at the end of the study endpoint. And mania response I will talk about very soon. But let's spend some time on mania symptomatology right now. Now, with mania symptomatology, which is reduction in the manic symptoms, this is really important here. So I will not go into detail, but you see these dark line. This is how many studies were there. The more darker, the more studies. And this is the number of subjects, number of patients in the study. So you can see highest was for placebo, followed by valproate, lithium, and risperidone, and others, and then quetiapine. But darkness is the number of studies. You can see most studies between placebo, valproate, placebo, lithium, placebo, risperidone, valproate, lithium. I'll not go into that. That's not relevant right now. Clinically speaking, it's relevant, but there were 18 studies, 2,844 subjects. But what's important for us to pay attention to us is this table on the left. I have actually included a table for everything so that you can know why the author said this. Now, in the end, I will talk about this. Cinema. They actually give their confidence on the data. They say it's low confidence, moderate confidence, high confidence. There was no high confidence in this. Everything was, I think, low, very low, or moderate. I'll talk about that, why this is relevant. But now, how to read this table? You see this one here, this line here, the line that is 0. So anything horizontally that touches it, crosses it, is not relevant. So for medications that reduce manic symptoms, according to this network meta-analysis, only 6 treatments perform better than placebo. This is not to each other, friends. This is with placebo right now. And you can see risperidone on top. I have actually done this so that you can pay attention. You see it's on more on the left side, the better. So risperidone was best actually in that right now. Followed by, we have olanzapine. Again, significant there, not touching that 0 line. Aripiprazole, quetiapine, azathioprine, and ziprasidone. Now, this is really important. These 6 treatment options perform better than placebo. And you can tell all are second generation antipsychotic. None of the mood stabilizer panned out. And that is where results were not significant for these one. You can see here topiramate, olanzapine plus topiramate, lithium, oxcarbazepine, valproate, right? Because they all were touching this 0 there. That is how the statistical analysis works. So these are the medications that showed efficacy in reducing manic episode significantly different than placebo, and these were the five which did not show. So remember that